Hi, my name's Dave Clark. I'm a podcast producer and I've been lucky enough to have been working with Caring Town on a networking event which asked the question, how can we support and collaborate with each other as we emerge from the pandemic to support our community's mental health? This podcast captures the flavour of the day as we also hear from some of the key speakers and attendees.
First began in 2013. We thought if we come together as health and welfare groups all those years ago and put our heads together and see if there are ways that we could actually maximise our capacity or help each other, support each other.
Yeah, my name's Carole. I've been involved with Caring Town since 2013 and my role now is a trustee stroke director. We decided way back when that if there were common issues in the community, it would be really helpful to have somebody to convene them, because it's really difficult to do that if you're in an individual organisation who's in the front line, to sort of stick your head above the parapet and say, I want to pull people together. So that kind of has become my role, and there were two key issues then, which were around rough sleeping and homelessness, and the second one was on keeping young Totnes safe, which arose when we had a community discussion around drug misuse amongst young people following the death of a 16-year-old. What I love about it is, first of all, discovering what amazing people and organisations that there are in this community, and their willingness to share with each other, to support each other, and the enormous creativity in coming up with solutions, testing things out, working together, networking. It's just been a joy. Although there are huge challenges, it feels like we can at least tackle them. We're not alone in tackling them. The issues around mental health emerged particularly through the pandemic for us as groups working within Caring Town. It was quite obvious that there's a significant increase in the numbers of people of all ages, but in particular young people who were really struggling. So my understanding of the system is that it's actually doing its best, but going back to one of the reasons we started Caring Town in the first place, it's so stretched that on its own it can't actually do much more than it's doing. So what solutions we will be able to find are part of this whole day. They're part of this initiative. It's the start of it, really. We put in a bid to the lottery to try and get some resources to help us do that. And that's why we're here today, basically. We wouldn't be here without the lottery. We need to work together to get a mandate, a collective voice, because we can't bake the cake all at once. We've got to get the ingredients together. But there is a willingness, and you can work with that energy, and it's just how do you unleash that in an effective way? And I mean that's something we'll be talking about.
Now I'm going to hand over to Aydin, who joined us in October.
I wanted to start with is put a bit of context to what's going on, and I'm really pleased we've got two speakers today. Darin Halifax, who works for what is the clinical commissioning group at the moment, but he'll tell you more about that. As the BCSE lead, and we have Alison Kingdon as well, who's been working on the community mental health framework. Now these are both important changes. I think it's more about just finding out some information today, a bit more about it, but within both of them there are potential opportunities for voluntary community sector and social enterprises to possibly become part of the solution to the crisis that's around mental health and wellbeing. So, just to provide a bit of context, if I can ask Darin to come up first of all, and just introduce yourself, and on your presentation.
I've been working now with 10 BCSE leaders over the last 3 months or so about what it could look like for us.
Hello, Darin Halifax.
Hi, Daryl, Dave.
So my name is Darin Halifax, and I'm NHS Devon's lead for our relationship with the voluntary community, social enterprise sector and social prescription. My job mainly is working with communities and people right at the coalface on how we can improve health services across the county to make sure people are happier and healthier. What I really like about the job in particular is I think it's a bit of a change of mindset for the NHS. So the NHS is, for many years, done a fantastic job, but it's based around treatment. And I think what we're trying to do as an organisation is to be much more widespread in our thinking, particularly around social determinants of health and how we can work with people to make sure that we don't just treat them when they're poorly, but we also help them not to get poorly in the first place. What really impressed me when I came to the event was the network that was already there. People were talking to each other and were filling gaps for each other, filling experience for each other. I think it's already there. I think it's a question of coordination. It's a question now of communication to make sure that the people at Totnes know what's out there. I think what you've done really well, and I think what you continue to do really well, is to make it not a non-threatening situation. I think so. For some people, reaching out for help with their mental health is the most difficult step, the first step. And if that first step can be a gentle one, not diving straight into treatment, not diving straight into health services, but actually reaching out to other people within your community, I think that's a much gentler way into seeking the help that individual might need. So it's really about us being creative, about working together and collaborating with each other so that any money that's out there is used in the most appropriate way, and it's not necessarily the people with the loudest voices who get the money, but it's dissipated out much more and cascaded out much more. I think to do that, you need to create a sort of a mentality of collaboration, which I think is already happening in the Totnes. And me as a commissioner would love to have caring towns across the county, because it's so much easier if we have when we do have some money to spend, which happens occasionally, is that we can just reach out into a town like Totnes and say, look, here's X amount of pounds. We really need your assistance on this particular thing. And then let you get on with it. That'd be amazing.
Next up, we have Alison Kingdon, who will be talking to you about the emerging community mental health framework.
When the statutory services couldn't do their bit or will pass them over, that conversation has really changed now, because we've realised more through the pandemic than at any other time, you have so much to offer, and you offer it in a way that is better received.
My name's Alison Kingdon, and I'm the Locality Change Coordinator for Torbay, South and West Devon. So my role is taking the National Community Mental Health Framework and operationalising it locally. So what that means is helping our areas, our localities come together collectively to support people who are experiencing mental health issues. I think one of the best things about my role and not being a mental health practitioner is I've been able to come in with a fresh set of eyes. And part of that is challenging current systems and processes and being able to influence change. That said, I'm very keen that our change is influenced by those that use our services and work in our services. I think what I got out of the day was very much there is a willingness, there's a passion, there's commitment, particularly from our BCSE colleagues, about developing, creating and moving change forward. For me, now is the next step about getting our primary services and our secondary services, like our mental health organisation, around the table to learn off people that work in the community, and actually to work together to create opportunities where conversations can occur about what matters for the individual, and create opportunities where their voices can be heard. I've learned about so many organisations that are attached to Totnes Care that we didn't know about, that we can tap into, which would benefit the outcomes for individuals that are experiencing mental health issues. And I think, for me, people that experience mental health issues also want to contribute back into their community. And that, for me, is the absolute key that I But I hope now, with me sharing my email address and contacting me, what I'm doing, that I've opened the door for further communication. Those, to me, are the challenges, that they're not surmountable, and we are working through them as they come up.
Today is just a dark day. It's a particularly hard day. I hope tomorrow brings a brighter day. Well, that's if
My name's Lucy Chenery, and I work with Action to Prevent Suicide, and I am coordinating the Natural Helpers Programme at KEVIC, King Edward VI College in Totnes at the moment. Understanding the big system for me it's challenging. I think it seems very rigid to me, and something which is it has lots of loopholes, lots of things to tick boxes for, lots of complications, jargon, and it seems like there's just waiting list after waiting list after waiting list. So I'm more interested in preventative care and how we can address what seems like a crisis situation and not dishonouring that, but how we can kind of get to the creative response to something. I feel the key for me is to resource all of the organisations with the knowledge of all the other organisations which are out there. So if someone gets a referral that they don't feel like they can manage, who else can we refer on to? So I think it's kind of widening the awareness of the network. Everything works a lot better for me when it's natural and spontaneous. And I think working with certain services, you're obliged and through legality having to do safeguarding procedures and all these kind of things, and it creates so much in some ways very necessary, but in other ways very unnecessary fluff around all of these things where someone actually may just be asking to be really deeply listened to. And I think the challenge is how complicated it is and how many loopholes we have to jump through.
Okay, so what's the first thing that you would do to change that?
Get to know my community, get to know who's out there, and to simplify my own way of dealing with things. If I meet someone who's in need and I need to respond to that immediately, who do I know from what I've learned about that individual, the conversations I've had with them, what are they interested in, what do they feel like they need, then I can go and respond to that. Okay. So it's my knowledge of what is around me as a practitioner and how we can work together.
My name is Chukumeka. Most people call me Chooks for short, Maxwell, and I am a founder and CEO of Action to Prevent Suicide, CIC, and the founder and advisor of Goodwill in Action to Prevent, CIC. And in the past, I've been a community development worker, health improvement specialist, and a part-time lecturer at Plymouth NXT University. So Action to Prevent Suicide came about because I was a health improvement specialist who was trained in suicide prevention. And whilst I was doing the training within the NHS, it just became apparent to me that many of the suicides take place predominantly in the community and they're not known to medical services. And I was also finding some of the causal factors around why people wanted to kill themselves were really in people's minds and hearts. And I was struggling within the NHS because when you work within the NHS, you're employed in a specific role and you can't normally transcend into another area. And I feel in my 62 years young of being on this planet is that we've got a lot of wisdom that comes from a collective body of people, not only the professionals, and it's really important for us to share that. And so I left and set up Action to Prevent Suicide as a response. And we do training, consultancy and support around suicide. But there's a broader sense of how suicide can take place, i.e. things that people do to kill themselves in a multitude of ways, because suicide is defined as self-inflicted death. So really, anything that could be the cause in someone's particular mind is the way that we're trying to respond, and then respond not only at individual level, which is our responsibility, but also our responsibility as a community. Unfortunately, I would say I understand the system very well. The problem is with understanding the system as it is that for me that reinforces a state of illness and people not being able to get a service. It's because it's set up in different situations, and it is a lot better. I'm not going to here be a naysayer thinking things designed, rooted in illness, I feel that that system needs to be overhauled because everyone within that system is suffering. I think we're in a very good situation. If you think back to the thing that's affected us all recently, COVID, in the first few weeks of COVID, once we got to the high end, spontaneous groups got together to offer acts of kindness and support in a way the NHS couldn't necessarily respond to. And it gave the NHS permission to let go and allow the process to take place. So some of the reasons why people suffer from mental ill health is because of societal issues, which if they're not addressed, then become emotional issues, which then become mental health issues. And each time we don't respond, we create more and more trauma or reinforced trauma because people feel so isolated. So it's really important, and that's how I think Totnes Caring and Caring Town Totnes came about, is to respond to the need that's right in front of your face at a given time. And I feel as a community and as a town that we can do this. So there's a sense of deprofessionalizing mental health, but also supporting people when they're struggling in pragmatic realities like feeding them, helping them go for walks, very simple things, so that people don't feel so disconnected, which later on could lead to suicidal thoughts and not wanting to be here.
Dyer. I'm the founder and director of Resilient Lives CIC. We are a social enterprise that works to help people, young people developing skills, but also people in recovery from poor mental health or addiction, homelessness, other trauma-related issues. And we use meaningful occupation projects as a way of helping people sort of re-engage with themselves, grow confidence, and sort of manage whatever they're living with. So we have two covered projects. One of them is Pizza Pirates, which is employability, where we train people to basically help run a small pizza pop-up. And the other one is Dobros, which is a men's mental health project, where we use pizza making as a kind of icebreaker and counterpoint to helping men talk about difficult feelings. What I identified at the event was lots of people with all the right approaches. People wanted to work together, but there was still a little bit of confusion around how we work together, and there's that age-old question of, well, who pays for us to work together? But I'm quite positive about it in a town like Totnes. I've said this to Caring Town, that I think what we have here is a microcosm of activity that we can almost use as a pilot study, that the will is here, where people do want to work together. There seems to be a little less competition and protectionism here. And I think that's really important in the town coming together as a whole. I think one of the outcomes of this kind of Caring Town project is to look at how we pull services together in a very sustainable way. I'm a big fan of filling gaps. So I believe that there's a little bit too much within the sector of people having a great idea and then doing it before realising that someone else has also had the same great idea and is doing the same thing. If we do a kind of mapping service, where are the gaps that we can fill in? And then how can we come up with something to fill those gaps?
Today was just a dark day.
This is a How production. Please share this podcast, and thanks for listening.